Hi viewers, we are again discussing one important medical topic today via this medium called as Lybrate, which allows you to have text, audio and video consultation to your doctor at any time. So my Lybrate viewers must have seen my earlier videos. This is just to educate all the viewers about certain common medical conditions. Last time we talked about the brain stroke, then vitamin D deficiency, typhoid. Now today, as this is December, January going on, I would discuss something about swine flu. Now we have come across with multiple cases in common flu or influenza type of illnesses, and sometimes we have to suspect that certain symptoms of patients, they may indicate that it could be something serious infection by the name swine flu. Now why the name swine flu? Because it's found firstly in swine or pigs. So it has a around 100-year story of detection of such kind of virus into pigs, and recently a lot of studies have happened. We have various strains of swine flu detected nowadays, H1N1 being the commonest, and there are certain mutation and genetic changes which happen in this virus itself. We have now H1N2, H2N1, H3N1, H3N2, H2N3, like that. So we need to understand that virus is changing its properties and its avatar and causing this kind of illness, which is mainly restricted to respiratory tract and causing severe respiratory failure, sometimes even death also. So that is how we are worried about this particular viral disease. So how we should suspect that it is not a normal flu and this is a swine flu? It is very difficult. Yes, it is very difficult, because the symptoms almost mimic in the same way. But there are certain population like diabetics, patient having HIV, patient who has undergone some kind of chemotherapy shots, patient who have got organ transplant and on immunosuppressant. In those cases, most of the flu cases, they turn into little resistant flu, and we have to suspect then that it could be swine flu also. And here we have to investigate case properly and do some immediate action to start some antiviral medication and protect the further complications of swine flu. There is other way how we can prevent is that whenever we cough, we should hold your mouth and allow that to a specified area rather than spreading across. We see that flu and other kind of variations of flu, they happen here in India somewhere in cold season. The reason are 3-4. The first is that we don't get full sunlight, so vitamin D generation which is happening, which is immunoprotective, is less. Our mucous membranes in cold season, they get dry, so we don't have enough mucus which protects naturally against the viruses and invaders. We ourselves confined to places because we don't go out because of cold weather, so we have our own reasons to stay at home, and that's how spread to other family members. So these are few reasons why we actually get flu in cold season. Therefore it is the name cold has attached to it. Now we get high fever. If it is 103 and above, we should suspect about swine flu and get it checked through your family physician. There is a test called as PCR, and that PCR, real-time PCR, is the positive indicator, and it has 3 strains which should show activity or presence of the virus particle into the sample. So sample collection is also processed into this. We have developed certain vaccines in protecting the individual. we have two types of vaccines for this. This is just for sake of showing you that we have for junior also, like one who is less than 8-year-old, we have 0.25, and for adults we have 0.5. The same vaccine which is in the double dose, like 0.5 ml is the adult dose. So this is how we protect the individual by giving this vaccination, and the protection time is 1 year. So I recommend that whenever you want to travel outside, or when you have some active patient who is undergoing some treatment and he is having some flu or some other symptoms, you can vaccinate yourself, or you have an active case in your family, you should vaccinate yourself to protect you. So this is one disease which has a very well documented and very well presented vaccination available, and we should avoid complications of swine flu and deaths happening because of this ever changing challenging virus by the name swine flu virus. Thank you. Now you can connect me whenever you want by searching my name Vishwas Madhav Thakur on Lybrate platform and get more information regarding this. Thank you.